This video has been prepared as a guideline only on the instructions for applying a basic total contact cast. This kit contains all the components to make a total contact cast intended to aid in the treatment of diabetic foot wounds and other indicated conditions. Contraindications and precautions: deep infection or abscess, osteomyelitis, gangrene, arterial insufficiency, exposed tendons, joints, and/or bones. Applying the Cutimed Total Contact Cast Kit. Always follow the instructions for use of each individual product included in this kit. Before starting the application, dress the wound with an appropriate dressing. The foot position and molding of the cast must be uniquely applied to the patient according to the location and/or nature of the wound, and individual modifications may be made to accommodate the unique anatomy and needs of the patients. Insert 5 cm by 5 cm gauze between toes to separate and prevent chafing inside the cast. Pieces of cast padding may be doubled and cut into squares for this purpose. Apply the Delta Terrynet S stockinette from the knee to 5 cm beyond the length of the great toe. Cut excess stockinette. Using the sheet of Delta Terrynet adhesive felt, measure the circumference of the leg to cut a 2.5 cm wide strip. Also cut 2 7.5 cm diameter circular pads and use the remaining material for a strip to cover the anterior crest of the tibia from the top of the tibial tubercle to the dorsal arch of the foot. Apply the cut pieces of adhesive felt on the crest of the tibia, the lateral and medial malleolus, as well as circumferentially at the top of the cast over the interior strip for added protection. Apply the adhesive foam starting at the plantar surface of the foot, fold around the toes to the dorsal metatarsal heads, allowing a space of about 1.25 centimeters between the end of the toes and the adhesive foam, creating a toe box. Trim the adhesive foam in the natural shape of the foot, leaving about 2 centimeters of excess foam near the toes. Apply the rolls of Specialist 100 cast padding overlapping 50% from the end of the foam padding at the toes to the proximal end of the cast. Use additional layers of padding by the heel by placing and tearing the padding from plantar heel to malleolus and Achilles heel to malleolus. Positioning and maintaining the patient's foot at 90 degrees angle, apply 2 rolls of Dynacast soft fiberglass cast tape from within 2.5 centimeters of the distal foam padding to within 2.5 centimeters of the top of the Delta TerryNet adhesive felt at the proximal end of the cast. This will allow the felt to be folded over with the stockinette to provide protection from the edge. The cast should be applied in a slightly angled fashion, higher anterior to posterior, to allow the patient to bend at the knee without impingement. Mold the cast, especially around the malleolus and plantar surface. Apply the Gypsona plaster of Paris slab from the dorsal base of the phalanges over the toes and plantar surface of the foot. Gently smooth the plaster around the toes with no undue pressure, and mold the plantar surface of the foot using the heel of the hand in the horizontal and transverse arch of the foot. Maintain the patient's foot at a 90-degree angle. Apply 1 roll of Delta Light Plus fiberglass cast tape from the base of the phalanges to the proximal end of the cast. Mold the cast, especially around the malleolus and plantar surface. Apply one roll of Delta Light Plus fiberglass cast tape from the base of the phalanges to the proximal end of the cast. And secure in place using one roll of Delta Light Plus fiberglass cast tape moving from the distal to the proximal. Fold over the stockinette at the proximal end. Gently roll 2 layers of Delta Light Plus fiberglass cast tape around the plaster showing at the toe, fold the butterflied ends in place, and secure by rolling the rest of the cast tape from distal to proximal. Apply cast shoe. Removing the Cutimed Total Contact Cast Kit. If needed, draw a line on the cast that will serve as a cutting guide, from the proximal end on one side, over the toes, and to the other proximal end. Insert the blade into the cast until the cutting pressure lessens, indicating that the blade is through the cast and touching the padding. Use a finger as gauge between the saw and cast to avoid inserting the blade too deeply. Lift the saw slightly, leaving the tip of the blade in the cutting groove, move along the cutting line about 1.25 centimeters, and repeat. Continue advancing on the cutting line in a series of up and down movements. Avoid dragging the blade without lifting it, as it will heat up, which may become uncomfortable to the patient. Repeat if needed to ensure the cast is entirely cut to the padding. Using the cast spreader, cut the padding and stockinette with round-ended scissors on the lateral and medial sides. Lift the cast and cut the remaining protective material to remove the patient's foot.